really excited for the session today. It is exactly 12 o'clock. And so as folks are joining, we're just going to go ahead and get started with just an introduction for the session and then move along to our didactic presentation. But you have found the Understanding the Fundamentals of Low-Risk Drinking session today. We are launching our very first Project Echo series focused on adult low-risk drinking. This is where you will gain insights into best practices, share collaborative experiences, and meet new colleagues in the space. We've got a great group registered today. The series hopefully will afford us all to an opportunity to make new connections. So my name is Sarah Kondrak, and I have the pleasure of supporting the launch of this new Echo series housed at the very first Project Echo Hub dedicated solely to supporting the behavioral health prevention and promotion workforce. So for some context around that, there are approximately 1,300 hubs in over 200 countries, and we're the first behavioral health prevention and promotion Echo series hub. And so we're just really proud that we're leveraging this model to bring innovative prevention resources to Ohioans. Next slide. Okay. This Echo Hub is facilitated by the Ohio Center of Excellence for Behavioral Health Prevention and Promotion, and you can visit our website. It's listed here on this slide to learn more about the center's work. The center is funded by the Ohio Department of Mental Health and Addiction Services and administered by the Ohio University's Voinovich School of Leadership and Public Service in partnership with the Pacific Institute of Research and Evaluation, which is called PIRE. Next slide. If you are new to the Project Echo model, I think it's probably most important to understand the core philosophy of all teach, all learn. In each session, we will start with a subject matter expert who will provide a didactic on an identified topic for the session. But what makes Echo so special and really effective is that the core value is everyone in the room has knowledge and experience to make a valuable contribution, and that we can all learn from the work of our colleagues and community members. Next slide. So why the Echo model? Some of the benefits of Echo are listed here on the slide. We won't spend too much time talking about it, but I really wanted to highlight that this model democratizes information and expertise for the public good. That's really the core of the model. It works to build workforce capacity, and it also just ultimately improves outcomes for communities. So some helpful tips for today. We just ask that you mute your microphone when you're not speaking. It's lunchtime, and we know many of you are taking your lunch. But if you can, please turn on your camera. The sessions are really intended to build community and relationships with our colleagues, and we'd love to see your face if possible. I encourage you to use the chat feature throughout the session, particularly if you want to share different resources that you have or insights relevant to the discussion. You may also use the raise hand function in addition to the chat for the discussion portion of the session. Please turn off all AI note takers. And if you are experiencing any technology issues, please reach out to my wonderful colleague, Nancy Clough. Her information is on the right-hand side of this slide. Next slide. As a hub team, we're committed to creating an inclusive environment and providing all of the necessary accommodations needed. We'll start and end each session on time and work hard to make good use of your time by providing quality content. The only recorded part of the session is the beginning and the didactic presentation, and this is out of respect for your privacy and the community members that you serve. Finally, we will provide continuing education credits, which you can earn by completing the evaluation after each session. So we also ask commitment from our participants. We ask that you help create a safe and respectful learning environment by valuing the opinions of your colleagues, using inclusive language, and protecting the privacy of everyone involved in the discussions. We encourage you to be open and share your experiences and have a supportive space that is also confidential. Next slide. Finally, I just wanted to remind you that we have a schedule for upcoming sessions. This series is held the fourth Wednesday of every month, and we have a youth vaping prevention echo that meets the second Wednesday of the month. So please join us for both if you can. And with that, I would like to introduce you to our presenter, Dr. Jim Lange. Dr. Lange is the Executive Director of the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery, which is an academic center of The Ohio State University. He does this all while remaining the coordinator of alcohol and other drug initiatives for San Diego State University. Dr. Lange is also an internationally recognized researcher in the alcohol and other drug field. He has expertise in both legal and illegal drugs, as well as alcohol and tobacco issues. So we're so lucky to have him here today. Welcome, Dr. Lange.
Oh, thank you. Happy to be here. So let me go through the scariest part of the presentation, me sharing my screen, and then we can move forward. All right. So this topic of low risk drinking is actually a really interesting and probably more complex topic than it might appear. So I'm going to start with some of the complexity. As researchers, we're trying to come up with what does it mean, and what would you do if you were trying to create guidelines. It became clear that there's challenges in literally every component of the process of creating this. One of it is the research itself on risk, whether you're talking about medical risk or injury or social risk. The research has, as it's measured in terms of the consumption amounts, is almost always in terms of a self-report number of drinks. And that is a complication because it relies a lot on the reporter, the subject, to give dosage types of information in something that isn't necessarily on their minds when they are consuming. And so it makes it difficult to set levels. But then also, there's just so many types of risks that are associated with alcohol that when you try to find a balance of risk so that you're going into the low side of things, you have to make choices about what are you trying to prevent. And as this quote saying, there are 60 major categories of serious health consequences and over 200 specific diagnostic codes in the International Classification of Disease 10, to which drinking contributes causally with a wide range of different risk functions. And so when you try to find this sort of sweet spot of what low is, you have to decide which of these hundreds of specific diagnostic codes you're trying to avoid. And so this is complicated. That said, it's an important concept because alcohol is embedded within our culture in many ways, and people are intent to consume. But we can start with the idea that the lowest risk is to not consume. And then you are increasing risk, but probably at a very marginal level with these low or lower risk guidelines. And then another component, as I was mentioning, was like that, how do people report? And so when we're talking about drinks, I think it's important to use what it is in how it's defined in the United States. And it is specific to the United States, our definition of drinks. Other countries have a similar or the same, but there are variations. And basically, you can imagine that a drink is defined by what is a typical mass-produced can of beer, which is usually around 5% alcohol. And with that being a drink, you can then use some math to, and that ends up being about 14 grams of alcohol. You could find similar sizes of drinks to equal that same 14 grams. And so that's a 5-ounce table wine and about 1.5 ounces of a distilled spirit. But of course, all of these things depend on what the actual alcohol content is. And it's not clear that people tend to pour in these particular quantities. So as we think about the guideline itself, or actually guidelines, because there's multiple ones that the government has set out, remember that we're talking about, when we're talking about drink, we're talking about these items, but not necessarily what people are actually consuming when they say they had a drink. So moderation, or according to dietary guidelines, and this is similar to different definitions, but they do differ a bit. Adults of legal drinking age can choose not to drink. That's actually the safest of the choices, or to drink in moderation by limiting to 2 drinks or less in a day for a man or for men, and 1 drink or less per day for a woman. So that's one, and it's pretty easy to remember, but that isn't necessarily what all of the definitions have included. So NIAAA has expanded on the concept, not just sort of daily, but the fact that people don't necessarily drink the exact amount the same every day. There's occasions in which you may be drinking more. And so if you want to reduce your risks in one of those occasions where drinking more may be either desired or, the norm, then you're talking about for a woman, low risk drinking is no more than 3 drinks in any single day, and no more than 7 drinks per week. So that goes to the 1 per day type of idea. But if you were going to consume more, it's for a woman, it typically would be safer if it's no more than 3 drinks. This is a gendered quantity, where for men, it's 4 drinks or actually they say in a day, but you can imagine that it's probably in an occasion. And then there's the 2 drinks per day, which gets you to 14 per week. So those are 2 different ones. And you might want to think about who are the people who might be more likely to fall into risk categories where it's about occasions of drinking versus daily types of drinks. And I work on a college campus. I work with young adults. And so I tend to encounter or talk to students more about occasions and the types of drinking that occurs at, for instance, parties, where we're talking about those spike days, not an everyday type of drinking. And that is sometimes called binge drinking in the field, and it actually kind of came about being called that by a study done by Wexler a long time ago, in which they looked at the types of risks that college students might experience, or types of negative outcomes that college students may be experiencing, and determined that, first of all, it's around 5 drinks, but for women, it's actually lower. So it became this gendered guidance on what binge drinking is. That's actually, that was an innovation that helped guide these low risk standards that we've talked about. But you can see the sort of outcomes that he was looking at. It's sort of like hangovers, missed class, that sort of thing. And it's at where about 50% of the students were experiencing those, but it was for 5 drinks for men, 4 drinks for women. Some of us a long time ago had some problems with that concept. We did a study at the Tijuana border where we were breath testing people going down to drink very heavily. This was before 9/11, so you could go crossing the border very easily. And we found that a whole lot of people who had been drinking in the binge level had relatively low BACs. And over time, that was a concern that more and more had. And we can see that NIAAA then adopted a definition of binge drinking, not by the number of drinks, but by the BAC that would be the outcome of those drinks. And then they gave an example of what a typical adult drinking 5 drinks or 4 drinks would get you to that sort of BAC level. And so again, we're getting to what are we trying to prevent in the consumption pattern? And here we're talking about spiking BACs being of risk, and that's going to be a risk of types of injury and other things like that. And so establishing what you're trying to prevent and how you're measuring the consumption is really critical, but it took time and some research to get to some of these places. So that's how NIAAA came about with that 0.08. But SAMHSA doesn't define it that way in their studies. And so they're still at a consumption level process. And so again, when we're talking about what are we trying to do, you need to think about what are you trying to prevent, what are the risks that are of interest. And it hasn't always been at sort of BAC level. So 0.08, of course, that number is magic only in the sense of traffic safety. That was the bar that we set when we were doing those breath tests. But in other times, like just after Prohibition, it was about taking care of your family, not wasting money, your responsibilities. So again, this is sort of culturally determined what we're trying to prevent and what it is that you're going to be measuring and talking to people about. And then another piece of this is you could do it from a cost benefit perspective. And actually we did a study in Columbus where there was a hard push to get people to use rideshare by giving away rideshare coupons. It was a very expensive project, but what ended up happening was people were less likely to drive impaired, they reported, but we also saw consumption go up. And with that consumption going up, you can then do a cost benefit on how much each glass or each drink and quantify it in dollars, what the cost to society and the individual would be for that particular drink. And it washed out the benefits because the consumption went up. So sometimes these pit against each other. You're trying to prevent an issue like impaired driving. You might then see other issues that arise because of consumption differences. And the other component of this is, well, how do you start the conversation and how do you know? And a lot of people use the audit as a screener for alcohol-related problems. And I just wanted to point out that within the audit, the first question doesn't conform to these low-risk categories. So first of all, it's not gendered, in which case the scoring that you're going to have doesn't take into account that if you are drinking 1 or 2 drinks and you're a woman, that 2 drinks is actually more than you would want to do on a daily basis. And so you actually have to start asking the questions in a manner in which you can find out if the conversation needs to change so that you can move people into lower risk categories. I just wanted to throw this out there because we're going to talk a little bit about not just the individual, but also societal components. But all of it is I think couched in, when you're trying to make change, understanding that what we're saying when you have a low risk standard is you'd like people to change to that lower risk. And again, 0 is the lowest of the risks. And so the conversations need to recognize whether or not people are actually ready to hear any of this information, or if they are, if they're pre-contemplative, how do you move them into having that discussion? Because you might be asking for change to occur. And so one of the examples of how we've done this in a college setting is training people who are hosting parties and having them explore what it is that they are trying to achieve by hosting a party. Why host a party? What are you trying to do with that? And have people list out those components. And usually the guests have the same. And so those we call the good things about the party. But then you can also have them explore the not so good things that happen at a party. Things get broken. There's vomit on the floor. There's, whatever it is that they can recognize. And then you can move them towards exploring, well, what's the drinking pattern when you tend to see the not so good things occur? And this is a graph of a BAC curve that I think is important if you're looking at that type of population where it's this binge consumption, because especially young adults, they will move very quickly up in the BAC curve and then do their best to manage their way down. But actually, most of the good things that they want to achieve come from either actually a placebo effect at 0 or up to about 0.06 BAC. And if they can keep in that zone of 0 to 0.06 as long as possible, they'll get as much time as you could hope to get for the experience that they were trying to, the good things, and avoid a lot of the not so good things that you would get from the high spike. That's the kind of education that young adults tend to want to hear because they intend to consume. And this is giving them the reason that they want to consume in a different manner. So you do have to still give them standard drink information, BAC information, but it's in the goals that they are trying to achieve. And they'll see that lower drinking patterns actually get to where they want to go. And then we can also look at some of the cultural experiences that are going out. So this was, I'm at San Diego State, so this was an offensive ad that I saw around our basketball team, where a beer company was advertising, and here's a gentleman with 3 drinks in their hand, already not in conformity with the lower risk drinking pattern. So being on the lookout for how our culture is educating and norming types of drinking patterns that may not be aligned with the lower risk drink patterns. So those are opportunities. I'm going to skip this slide a little bit. Just know that, especially with young adults, they're usually drinking in groups, so that not just societal norms, but also group norms are important, and people can start learning how to move their friends during events into the lower risk drinking. So those are all opportunities. Also, cueing people at the right time, right place can change consumption. This was a study we did at the border, where by just asking people who's your designated driver, we lowered the BAC of returning drivers. And if a group is involved, together, a group of friends, it'll reduce it even more. And so sometimes you're educating, sometimes you're reminding at the right time, the right place, and sometimes you are trying to change the norms. Those are the aspects that you can move people towards those lower risk approaches to consumption. And with that, I'm going to stop because I think I went over, and just give you a little info on, or a little QR code, how you can connect with the Higher Ed Center.
All right, thanks, Dr. Lange. For those of you, you actually were right on time, and asking someone to put their life's work into 20 minutes is incredibly difficult. And so definitely appreciate that, drive-by presentation for us to really establish some of the foundational information that we're going to need for this ECHO series, providing the spectrum of alcohol use. You talked about different definitions and how these can be culturally determined. We're going to have some great discussion later in the session.